A COVID baby boom is happening at Singing River Health System. Births are up since pandemic quarantining, and the health system is preparing for a 30% increase. Joining us to talk about that, labor and delivery manager and registered nurse Lori Weimer. And thank you so much, Lori, for joining us. And this doesn't come as a huge surprise because, of course, people have been quarantining. They're home a lot more, and they're having babies.
Absolutely. We actually started preparing for this baby boom back in July and August, knowing what quarantine would do for our families in South Mississippi. We began asking the doctors for their numbers, and so we could get prepared with staff and facilities to take care of the new moms and babies.
I know that COVID-19 can be dangerous for pregnant moms, especially certain pregnant moms with certain conditions. How difficult has that been for labor and delivery the past year?
We have been fortunate to have been able to staff up so that when we get a COVID positive mom, that mom and baby gets their own nurse the whole time they're in the hospital so that they can stay isolated, stay together, and stay safe.
And I know the whole question about vaccinating pregnant moms is still, there are still a lot of uncertainties with that. I think certain ones are definitely recommended for certain women, but there's limited data out there right now, so it's not just across the board. They're not saying all pregnant moms should get the vaccine, right? Isn't that still the case?
Correct. That's a decision that we encourage moms to make with their physician, depending on their age, their pre-existing conditions, and their health, whether that is more beneficial to them during their pregnancy to be vaccinated or to wait till after they deliver.
And I know you said the hospital prepared for the boom. What's it going to be like with a 30% increase?
Well, we've actually had good opportunity to have some extra space to house moms after they deliver. So we've had to do a little bit more shuffling around after delivery, making our labor rooms more available. But we've had the opportunity to have the space and the staff. So we are just looking forward to having the increased deliveries.
And tell me about this new program. I think it's courtesy of a grant, really, this mom care that's available just to really get care to expectant moms who may not otherwise be able to get that kind of care.
Right. We are so excited about this. It is started through a grant from United Healthcare to try to prevent maternal mortality. Maternal mortality rates are very high in Mississippi especially, and especially among Black moms. And so we are trying to get out into the community to talk to moms, to screen them for high blood pressure, for diabetes, and to educate them on getting early prenatal care and even care before they decide to become pregnant.
And this is for moms. It's called Mobile Mom Care. It's for moms 18 to 36, is that right?
Yes, basically we'd like to reach women of childbearing age that are planning a pregnancy or are early in their pregnancy and help them identify health risks such as diabetes and hypertension that will cause them problems later in their pregnancy and, of course, later in their life as well.
Right, catching it early during the pregnancy, so important. So are you encouraging them to call Singing River about that then?
Well, actually, we're having events. They can find the events on our webpage for the hospital. We have an event scheduled for the Interactive Center in Pascagoula for Thursday from 9 a.m. to 1 p.m. where moms can come out. We'll do some education with them. We'll check their blood pressure, check their blood sugar, and kind of help them identify any barriers they have to care so that we can connect them to care.
All right, Lori, thank you so much for joining us today, and good luck with all of those babies. I know it makes everybody happy there.
Thank you.
All right, thanks for joining us from Singing River today.
That don't kill me, can only make me strong.